Okay, welcome everyone. Good morning. My name is Jeanette Diaz and I am the Public Relations Council Chair for the California Dental Hygienists Association. I would like to thank you for joining us this morning. We have a panel that we've put together to give you the updates on what CDHA has been doing and to answer some of your most frequently asked questions during this pandemic. I want to make it very clear that the intent of this meeting is to inform our members what the California Dental Hygienists Association is doing during this unprecedented time. Information is changing daily, and we are doing the best that we can to keep you informed. Next slide, please. Legislative advocates Aaron Reed and Associates with Jennifer Tannehill joining us today. And lastly, we have our government relations co-chairs, Rhoda Gonzalez and Allison Yoakum. And I, Jeanette Diaz, will be serving as your moderator today. Next slide, please. So the topics that will be addressed will be what CDHA has done so far, how the legislative powers and processes work, how to stay informed, and ways to get more involved. We will also be answering your commonly asked questions at the very end. So please feel free to submit your questions to the chat box. Now it is my pleasure to introduce you to CDHA President Darla Dale.
Good morning, everyone. I want to welcome you from the California Dental Hygienists Association, and thank you for your interest in this topic. I know it's been a really interesting time in California for sure. What I wanted to talk to you about this morning was mainly two things. Of course, CDHA is working on many things to advocate for dental hygienists in the state of California, but there were two things that had happened recently that I would like to discuss this morning. The first one I want to discuss was the Department of Consumer Affairs waiver request that CDHA submitted. There was an executive order authorized by the director of the Department of Consumer Affairs to waive professional licensing requirements that govern healthcare professionals. And that waiver went out in March, late March. And what occurred with that was the California Dental Association approached CDHA and asked for their support because they were going to request a waiver that would allow dental students who had completed all of their requirements in dental school to be able to waive the clinical exam so that they could enter the workforce. They asked us to align with them, and we decided to join them in that request. So on March the 31st, the California Dental Hygienists Association, or myself as president of CDHA, put in a waiver that requested the Department of Consumer Affairs and the Dental Hygiene Board to allow dental hygiene students who had completed the program requirements for graduation as certified by their program director to be granted licensure without having taken a clinical licensure exam. There was a reason behind this. It wasn't just to give everybody a license all of a sudden. What had occurred was in the COVID crisis, when it was at its peak, and still in some places it's still peaking. But what they had said was that they wanted healthcare professionals to be able to go to the front lines and replace some of those exhausted medical workers that were on the lines that had been working hours and hours. We had felt that the dental hygiene profession, the dental profession may be called to also help and assist in the COVID crisis. We felt that these people would be able to join that workforce. So we did ask for that waiver. And I wanted to emphasize, because there was a lot of chatter going around, negative and positive, regarding CDHA asking for this. This was a one-time waiver. It wasn't to be in place forever. It was just to take place during this COVID crisis. So it was a one-time deal. It wasn't something that was going to continue on. So the Department of Consumer Affairs had a week to respond. It took them a little longer than that. And they did respond, and they did decline our waiver request. And the reason for that was that they felt that the crisis did not dictate at that time that they needed dental professionals to come forward. So they declined our request and stated that they would revisit that request if they felt that it was needed. So that's everything that I had about the waiver, because there was a lot of discussion about that. The other item that is ongoing now is CDHA I had discovered that the California Dental Association and the dental director for the state of California had formed a return to work clinical care work group. And the day that I found it, I discovered that on social media, actually. So I immediately contacted President Richard Nagy of the California Dental Association and asked that CDHA be involved in this to represent the hygienists in the state of California. He got back to me immediately, invited CDHA to join. And because of that, they also asked the president of the California Dental Association to join. I'm sorry, the California Dental Assistants Association to join. And I think that's really great because we represent, the staff in the office, and it's important that we be a part of this discussion. And I know dental hygienists are really concerned about their safety in returning to work. So this COVID-19 clinical care work group that I'm involved in, we meet 3 to 4 times a week for 2 hours a day doing Zoom meetings discussing what's going to happen when we return to work. There's a lot of concern and discussion about that. I know that currently we are not recommending dental hygienists return to work, dentists to return to work, only for emergency care. What we're doing in that work group is protecting dental hygienists and dental professionals by discussing personal protective equipment, the availability of that, and how that's going to look when you return to work. There are several other factors discussing aerosols and the activity of aerosols and what's happening with those. So I'm personally involved in the PPE group. They broke off into 3 separate groups to sort of focus on different topics. I chose to be in the PPE so that I would be working on keeping the dental hygienist safe in the workplace. I think it's really important, and I'm very happy that we were involved in this. And just to let you know, we're working daily in this group to help us get back to work. Thank you.
Thank you very much. Thank you, Darla, for the informative update. Thank you so much for the work that you are doing and representing the California hygienists in this task force, especially in the PPE department. So now I would like to introduce Jennifer Tannehill. This is CDHA's legislative advocate with Aaron Reed and Associates.
Thanks so much, Jeanette. Appreciate being here with you all this morning. Good morning, everyone. Aaron Reed and Associates is CDHA's legislative advocacy firm. We are in Sacramento and lobby the legislature, the governor, and state agencies on behalf of CDHA. We represent a variety of associations, but CDHA is by far one of the most passionate and engaged that I get to work with and lobby for. CDHA's all-volunteer leadership continually fights for dental hygienists' advancement and improving access to dental hygiene care. I'm excited CDHA has created this panel today and to be able to be part of it, and to share this information with you from people from throughout the state. So today, let's, for background purposes, talk a minute about the legislature and the governor's administration, which is the executive. For background purposes, the California legislature is made up of 80 assembly members and 40 senators. The governor, along with the agencies, departments, and boards, are a separate branch of government known as the executive. This includes the Dental Hygiene Board of California, which issues regulations to implement the laws passed by the legislature that are related to dental hygiene. DHBC's regulations have the force of law. The legislative branch are the elected representatives of the people and controls the state budget spending. Each assembly member represents a district of about 500,000, and each senator represents 1 million. So during this crisis, Aaron Reed and Associates has kept CDHA connected to the actions the state is taking related to COVID-19. We alert the legislature, committees, and governor's departments as to how the crisis is impacting dental hygiene, how critical safety protocols are, and how they are needed before returning to work. At the beginning of the COVID crisis, the governor called a state of emergency. This gave the executive more authority and the state access to federal dollars related to the emergency. The legislature passed bills giving the governor the authority to spend state dollars to fight the virus, and then the legislature recessed due to the shelter-in-place rules. Normally in May, April, April, May, and June, the legislature is holding committee hearings to vote on the thousands of bills that they introduced this year. Due to the virus, the legislature is remaining on recess and is wrestling with creating protocols for safely resuming hearings and floor session. The situation, as with all things right now related to the virus, is very fluid and changes daily. The Assembly is expected to come back on Monday, May 4th, to go into session and vote on some COVID-related bills and to work on the budget. The Senate is expected to return in a very limited capacity the following week. Some hearings are happening online. As for dental hygiene and every business in the state, things will be very different going forward, and just how different still remains to be seen. So slide 6, who decides? The state legislature and the governor are the people who decide how laws are passed and and they determine how dental hygienists are allowed to practice and what the scope of that practice is. This is why having a strong state association that interfaces with the government regularly is critical to the practice of dental hygiene. Aaron Reed and Associates works on behalf of CDHA to support or oppose bills, work with the governor's office and state health agencies, and work with other associations and stakeholder groups to advance the practice of dental hygiene. Your part in all of this is to participate in your association, know who your legislative representatives are, and get to know them. When a big issue is then up for a vote in the legislature, CDHA members can call their legislators to request they support or oppose certain issues. Your efforts really amplify the work that CDHA and Aaron Reed and Associates are doing in the state capitol. It gives you and your state association a strong voice with the policymakers, and this ensures policymakers know there are real dental hygienists in the district that are watching how they vote. Signing petitions can also be a useful tool. Petitions do not have the force of law. However, when thousands of people sign a petition, CDHA can then share that petition with the legislature and the governor, and the petition may help apply pressure in support of CDHA's position on an issue. Mandates are requirements by government entities. CDHA is not a government entity, so it cannot mandate any action or any other group take any action. However, CDHA can make recommendations and promote best practices and guidelines and issue guidelines. CDHA and Aaron Reed and Associates together work to influence decision makers on behalf of dental hygiene. And I'm pleased to be part of that process. Thanks so much for taking time to participate in this call today.
Thank you so much, Jennifer. The topics that you covered can be a little confusing, so we appreciate you taking the time to explain these things to us. Thank you for the advocacy work that you do for the California Dental Hygienists Association. I now would like to introduce you to Government Relations Co-Chair, Rhoda Gonzalez.
I'm unmuted. Thank you. Thank you so much for being here today. I'm going to spend a few minutes just talking about how to get informed and how to stay informed. During these uncertain times, it is especially important to base our evidence-based practices and share that. So where do we go? How do we get informed? Where do we find our legislators? I'm going to cover that in the next few minutes. On a high level, every morning I wake up and I go to the Johns Hopkins University Coronavirus Tracker. And this is something that breaks it down by a national, a worldwide, and then smaller into a California down to a county level. So that's a big array. Underneath there, you can go to CDC. Also underneath CDC, we've got the American Dental Association, who just came out with new guidelines this week. American Academy of Pediatric Dentists also came out with guidelines this week. We've got Underneath a national platform, we have California Department of Public Health. So California Department of Public Health is who is guiding us. You can sign up for newsletters. You can sign up and go online. That is readily available. Also, Department of Healthcare Services. They issued a great bulletin on Friday, and it broke down, we're following California Department of Public Health's guidelines, and in their provider bulletin, it specifically states what a dental emergency is, aligning with both ADA and the California Department of Public Health's guidelines. Now we can go even closer to what fits you at home. Get to know your representatives in your county. Get to know your county public health department. Most of them, I'm sure, have on their website a link for COVID-19. That will break it down in your county and specific to your city, how many positive cases they have, how many tests they've run, and furthermore, where those are. You can sign up for their email blasts that come daily, but be informed and keep it evidence-based. Stay informed with CDHA. We're branching out and we're providing information to our members and non-members alike who are on this call. And that includes newsletters from public health listservs. So if you want to stay tuned on the very end of this presentation, we will be listing some of those listservs that provide evidence-based information so that when you come back to your dental team, you are available with the evidence that we're following in guidelines throughout California and the nation. Thank you.
Sorry, everyone. I think I'm unmuted now. So thank you, Rhoda. You gave our members lots of resources. Please know that our CDHA website will be updated with these resources at the end of this meeting. I now want to invite Government Relations Co-Chair Allison Yoakum.
Hi, thank you. Good morning, everybody. What I'm going to talk about is how to get involved now. So a lot of what I'm going to say is going to piggyback off of what Rhoda was talking about, specifically how to find your legislators. And the photo you see here is actually a photo from our CDHA Legislative Day. This was from our most recent day in January. So we go once a year down to Sacramento or up to Sacramento, depending on where you are in the state, and talk to our assemblymen, our senators, and legislative aides about the issues affecting hygienists. So I would strongly encourage you to join CDHA because opportunities like these become available. But in the meantime, to get to know your legislators, I would encourage you to not wait for a pandemic. I am so enthralled to see how many people are really invigorated by this time, so that we're reaching out to Governor Newsom, and some of us have never reached out to Governor Newsom or any governor before. But one way to get involved is to actually go to findyourrep.ca.gov. So this is a way to find out who your senator, who your assembly member is. And you can also find out, once you find out who that is, you can go and sign up on their website for their newsletters. Now, this is really powerful because one time I signed up, and I'm in San Francisco, so Senator Scott Wiener is my senator. We received an town hall digitally right now. Who else wants to join me on this and ask him about making sure hygienists are safe coming back? And we ended up getting 3 hygienists on that digital town hall of 66 total viewers at its peak. And he was reading off the questions and going, another question from a hygienist. So it's easier than ever because we are right in front of our computers to do this. But once you sign up for a senator or assembly member's newsletter, or your supervisor in your city, your mayor, and can do coffee talks with them, meet in person and show them, hey, I'm a real constituent. I am who you're accountable to because I am in your voter district. They can see what our issues are because they don't understand it they're lay people. They're just like our patients. They don't understand what it's like to be a hygienist and what our concerns are. So we often will have bills coming out sponsored by CDHA, and this is an opportunity to really get in front of our legislators during these in-person town halls. You'll realize the breadth of issues your community is facing too, and how you fit into the bigger picture, because we are healthcare workers, we are healthcare providers. So you and your input is very valuable. It's always going to be valuable, especially as a preventive healthcare provider. So let's see, I just wanted to bring up a couple other things, because we already talked about recruiting another hygienist to like a Facebook Live video or going to a town hall together. Ways to do that: think about who's in your component locally at CDHA, who's in your office, who's that other hygienist that's on the off days or not working, who's the hygienist that's local to the area or that you went to hygiene school with that is still around you and will join you, because there's power in numbers. The more voices we have, the stronger our message is, the more it will be heard, the more it will be top of mind. So membership for CDHA, we'll go into that a little bit later, but it can be done in quarterly payments if the cost feels too high for you to do all at once. And then the last thing I wanted to mention is staying engaged. So it feels really good to actually have your voice heard. I know every hygienist, when they leave legislative day with CDHA, walks away with this feeling, yes, I was heard, I'm invigorated, it feels really good. But especially a time like now, when it feels like you're drinking from a fire hose, or you have to mitigate, different changing county guidelines, and it can be exhausting to stay informed. So it's important work, though, especially right now. I know we're all worried, but remember that your voice only gets heard if you use it. So we'll go into some questions and answers a little bit later about the ways to specifically make your voice heard during this time. But please remember, do not let it get to a crisis to feel like your voice is important, because it's always important. Okay, thank you.
Thank you so much, Allison. I think you made a great point in reminding us that our legislators, they're just regular people. And I can say for myself, when I've gone to lobby day, it could be a little overwhelming, but I think that CDHA does a really good job at helping us like mentor us to know how to talk to these people, but they're just everyday people like us. So thank you for mentioning that. So now we're going to go answer some of the most frequently asked questions from our members. So number one, why isn't dentistry being addressed in the media, and what is CDHA doing about it? Darla, can you help us with this question?
Oh, yes. My take on this, because I'm following everything really closely regarding dental professionals, my take on this is that right now the media is focused on the national picture or the state picture. And at this point, they're not singling out any particular profession. We do have, in the past, we've had some local coverage. There was an interview in the very beginning of the COVID crisis. There was an interview in Sacramento with a dental hygienist and a dental team there as to what was happening with their dental practice. So I think that eventually, once the different stages are opened up in the state of California, there will be more focus on the dental practices. But currently, they're more concerned about the broad picture and not singling out any particular profession at this time.
Thank you, Darla. Okay, next question, please. So, is there a bill or is there anything dental hygiene related that we should be aware of? Jennifer, can you help us answer this question?
Yes, absolutely. CDHA has sponsored Senate Bill 653 by Senator Chang. This bill allows RDHs to work in more public health settings and allows RDHAPs to provide care to their nursing home patients in medical settings on a limited basis. We are negotiating with the California Dental Association and the legislature to expand the types of medical settings in which an RDHAP could provide care. This year, the bill may not move due to the legislature only hearing COVID bills. If that is the case, we can reintroduce the bill in the new session in January. We continue to work to get support from other healthcare related groups and the legislature. Check CDHA's website for updates and subscribe to CDHA's emails and socials to stay informed.
Thank you, Jennifer. So next question, please. So what benefits do I get from being a CDHA member? What are the costs versus the benefits? I can answer to this. CDHA has many benefits besides legislative advocacy. The cost to be a member are $210 plus a $30 fee for your component. We do have quarterly payments that are available. So we have a journal publication, we have disability insurance, we have auto and home insurance, we have a financial wellness group, liability and malpractice insurance, we have a vision plan. We also have student scholarships, and we have a reduced rate for the first year for new professionals, as well as retired hygienists. More than anything, I think the networking and the mentoring opportunities with being CDHA members are truly priceless. Darla, can you comment to the healthcare insurance, please?
So CDHA has been working on group health insurance. And when we polled our members and took a survey of our members, the biggest ask from those members was group health insurance. Many of them are working different offices, and so not being full-time, they don't have access to health insurance that's being offered by their dentists that they work for. So CDHA has spent actually the last 4 years trying to find a group health insurance program. Unfortunately, in the state of California, there was a law put in place that did not allow associations to offer group insurance plans. We are still working on this. I had a discussion last week with an insurance program that is trying to creatively work with our association to see if we can offer this plan. It is something that the hygienists have really been wanting to have available to them. So we are working on it and have been working on it for a while. I also wanted to add something to what Jeanette was saying about the benefits of joining CDHA. There's benefits in numbers. CDHA, being a professional organization, does advocate for you in Sacramento. It is important to know that in order to change our profession, or in order to make progress in our profession, a lot of times legislation has to be made in order for us to do that. And this is what CDHA does for dental hygienists in California. We advocate for that profession. So I just wanted to add to that as being a benefit of a member of CDHA, because we are working hard for you to advance our profession. Thank you, Jeanette.
Thanks, Darla. Okay, next question, please. So can we expect any changes to the scope of practice? For example, maybe nasal swabbing by the RDH at this time? Darla, can you speak to this?
Yes, I can. So during the COVID-19 work group that I'm on, I did ask this question of the work group, which is composed of quite a few dentists and also our dental director for the state of California. And just to let you know that what is happening at the California Department of Public Health also comes from recommendations from Dr. Kumar. And Dr. Kumar is on this work group and very active in this work group. And he will be taking our recommendations to the California Department of Public Health. So one of the questions I asked was, one of the things about getting back to work is testing. It's a big one for the governor. He really wants to see testing happen. And so we're thinking that this would be a good opportunity for the dental professional to do this testing prior to providing dental treatment to our patients. The nasal swabbing, from what we understand, would be an instant, is the patient COVID positive? And my ask was, would dental hygienists be allowed to do this? At this time, I asked our legislative advocate, Jennifer Tannehill, if we needed to change our scope of practice. I'm hoping that we don't have to go that far, because that would take some time in legislation to do that. I'm hoping that out of this work group comes the opportunity for the dental hygienist to do this testing, since we do have a lot of contact with patients on a pretty regular basis.
Thanks, Darla. Next question, please. So I am very concerned about the risk of COVID exposure, particularly for dental hygienists, and the legislator not being aware of this. How much is dental hygiene currently a priority to the legislator right now? And if it's not very high, what are your recommendations for the most impactful ways we can get on their radar? Jennifer, can you speak to this, please?
Absolutely, thanks. Due to the shelter-in-place orders, the legislature is in recess. Most of the decision-making during the crisis to date is by the governor, Department of Consumer Affairs, and the licensing boards when it comes to safe return to work protocols. CDHA is working with the governor's task force on returning to work, safety protocols for dental hygiene. Once protocols are created, CDHA will notify members so you can support the adoption of the protocols by contacting the key decision makers. It is uncertain yet if that will be the legislature or the executive, but we will keep you posted.
Thank you, Jennifer. Next question, please. So why don't we form a union? What are the pros and cons of a union? Darla, can you speak to this, please?
I have been following social media quite closely on a regular basis, just as everyone else is, I'm sure. And I've been seeing this question quite a bit. And so what CDHA has decided, and I as president of the California Dental Hygienists Association have decided that we will be forming a task force to look into if there is an opportunity to form a union and if that would be a positive thing for the dental hygiene profession. So I will be appointing a task force soon to be looking into this.
Great, thank you, Darla. Next question, please. So are we working with OSHA, or can OSHA be mandated to visit dental offices like they are in hospitals? Jennifer, can you speak to this, please?
Yes. CDHA cannot mandate OSHA to take any action. However, both OSHA and the Employment Development Department have resources on their websites that you can use if your workplace is operating unsafely or if you are being called to work inappropriately. Check out their websites. It's the Employment Development Department of California and Office of Safety Hazard Assessment. So if you're having any concerns along those regards, check out those two agencies, and they should be able to give you some direction. Each issue is handled on a case-by-case basis.
Great, thank you, Jennifer. And again, lots of these resources, we've mentioned a lot of resources. They will all be on our website following this meeting. So next question, please. So if I go back to work before the governor says it's okay, does that jeopardize my license? Allison, can you speak to this, please?
Yeah, absolutely. So we've actually been in touch with the Dental Hygiene Board of California about this question. And DHBC is working to determine whether there are any licensure consequences for returning to practice and not abiding by the executive order to stay at home. Generally, it's advised, as always, to follow the law. And if you're unclear about what your county is ordering regarding teeth cleanings versus what the state is ordering, I'd encourage you to go directly to your county's website. Go to your county's public health department website, look at the stay-at-home order for your own county. Oftentimes I've noticed for hygienists, it's in the FAQ section. And a lot of times it'll also have the verbiage, if there is any discrepancy or conflict between county and state orders, the stricter order prevails, or something to that extent. So really, it's up to you to personally go to your own county's website and also check the governor's website frequently, because this is a dynamic, fluid situation. It's changing all the time. And I want to point out that actually the governor's site right now makes it very clear under the FAQs, first for the FAQs of the stay-at-home order, then healthcare. The second question down is regarding dental cleanings, and it says they should not be done right now. I'll just read it directly. It states, what about routine, elective, or non-urgent medical appointments? Preventive care services and non-emergency surgeries, like organ replacements and tumor removals, can take place if hospitals have enough capacity and protective equipment to do so safely. Eye exams, teeth cleanings, and elective procedures should be canceled or rescheduled. If possible, healthcare visits should be done remotely. Contact your healthcare provider to see what services they're providing. So the governor's order is a law, since it's called an executive order. even though it contains the words should be instead of must be canceled or rescheduled, be aware this is your license on the line, okay? CDHA cannot advise you what to do one way or another. Aside from giving you guidance about the resources you can look for and check frequently, as I said, because they are changing, and we can just kind of guide you in the right direction, but it's really up to you to be able to look at this information yourself and advocate for yourself in your office.
Thank you so much, Allison. Excuse me. Next question, please. So what if I don't feel comfortable going back to work? Am I legally obligated to return to work? Darla, can you help us answer this question, please?
This is another question that's come to the California Dental Hygienists Association quite a bit. Unfortunately, we do not have the control of our employers or telling them what to do. If you're not comfortable going back to work, reiterating what Allison had to say, I would contact your public health department, let them know the position you are in and what their recommendation is. We, again, cannot tell your employers how to handle their businesses, but keep informed. You can contact the Employment Development Department. I also, if you're being forced and feeling very uncomfortable, I would contact maybe the labor board to express your concerns. I would constantly remind the dentists that you are working for what the governor's order is. And just keep informed, know what your county recommendations are also. And as long as you can quote what the orders are out there in the public, you should be okay. Some of these dentists will refute those suggestions, but I think you have to stand up for yourself and let them know that this is a very strong feeling that you have about returning to work and not feeling safe. Working on the COVID work group, that's what we're doing. We're trying, daily to come up with how to keep the dental hygienists and the dental professionals safe. And until that comes out, I would say that the governor's order is going to definitely stay in place about dental elective care.
Thank you, Darla. Okay, next slide. So before we move on to answering some of the live questions, panelists, is there anything that you want to mention that maybe didn't come up earlier? Anything from anyone?
I had something. I forgot to mention that one way to stay really involved and informed is going to the Dental Hygiene Board of California meetings and the Dental Board of California meetings. Anyone can come to these meetings. You don't need to be a hygienist or a dental professional. Any member can come. You can speak on behalf of yourself. You can bring up points that, that raise your concern, and there's always an opportunity to publicly comment. This is a great way to make those in the decision-making positions of our dental profession consider your points. One thing I also wanted to bring up that's totally an aside from that is I want to be cognizant of time, because Darla is actually heading to one of those 2-hour meetings 4 times a week for the CDA task force at 10 a.m. So I just wanted to put that out there, because we will be answering questions, but I wanted to make it clear that we're also going to have a hard stop at 10, okay?
Thank you, Allison.
I also wanted to add to what Allison said. We have a lot of, again, I'm following social media. There's a lot of chatter out there about what is CDHA doing, and then some people saying that they're not being heard. I want to let you know that on the CDHA.org website, our calendar is there. If you're a CDHA member, you are welcome to come to any Board of Trustees meeting and discuss your concerns. We can get things on the agenda. Things like that need to be discussed. So attending our Board of Trustees meeting. And also we are available. You can call the CDHA office. You can get in touch with any of us through email. So I just want to throw that out there so that you know that you can be heard by CDHA.
Thank you, Darla. Okay, so I'm going to move on to look at some of the live questions that came up. And please note, we've got a lot of people on this on this webinar. And we can't answer every single question, but we are going to answer the ones that are coming up the most, okay? So here's a big one. Sacramento County announced yesterday that preventative dental services are being made available starting tomorrow. Darla, can you speak to this, please?
Yes, I will personally be contacting the Sacramento Department of Public Health and discussing the current orders that are in place and informing them of what Governor Newsom's order is, and also letting them know that there has not been a decision made by the California Department of Public Health, which they are under. Any county health department is under the California Department of Public Health. And so I will be letting them know what the current order is in place. As president of CDHA. I also encourage any dental hygienist in Sacramento County who is having issue with this to also contact their local health department, the Sacramento Department of Public Health. I'm also having our trustee, requesting our trustee from Sacramento to also contact and inform what the current order states.
Thank you, Darla. So here's another question that's coming up. What is CDHA doing specifically to help us keep our jobs and go back safely?
I guess I should answer that question. This is what we're working on with the Back to Work work group. So again, it's kind of repetitive, but we are working on particularly the PPE. We are aware that there's a huge shortage. So we're looking at also alternatives to the N95 mask, things that are not necessarily available. But our biggest concern is safety of our dental hygienists. So I do ask a lot of questions when I'm in that COVID work group, and also make sure that we discuss the dental hygienists and their concerns. I have the opportunity to state some of the concerns that I am getting from dental hygienists in California to this work group, and they're very helpful in answering what's going on. The return to work is still going to be a bit of time, unfortunately. And the dentists that aren't hearing this probably are the dentists who are not members of the California Dental Association, and also are not following the California Department of Public Health recommendations. So I can emphasize again that you may need to take it upon yourself to educate them.
If I can just add on to that point, Darla, I've seen a lot of issues of people having problems talking to their dentists, and it really comes down to, in my mind, thinking about our roles as hygienists in an office. You know, we're very accustomed to educating our patients about the oral systemic link. We're educated in terms of the science behind things, how to do things, preventive care. But you know, I think it's also a time where a lot of us are realizing we need to have better communication with our dentists. And I've actually been very proud of how CDA has handled this compared to some other state dental associations or the National Professional Association for Dentists, because I think that they've been actually pretty strong, forthright advocates for us as hygienists, and keeping the staff safety in mind, and keeping patient safety in mind. And frankly, these guidelines are still coming out. You know, we're still learning about the virus itself, but this is an opportunity for us to have a leadership role in the office. Of course, we're not the bosses. We're not going to be making the purchasing decisions on what happens, but we can present the science, which we do with our patients all the time. We can present the guidelines put forth by the governor or our county. So I think we have a real big opportunity here to be that excellent communicator role that we often are with our patients, but with our dentists. And this can actually be an opportunity to improve our relationship with our dentists. I know not everyone has a great relationship with their dentist, but you know, it's communication and trust is going to be so crucial in this time to move forward, because we all want jobs at the end of this, right? We all want our practices to succeed. We all want our patients to be healthy. We don't want to feel bad if we're remotely compromising anyone, ourselves or our patients. So the way to get through to that point is really about communication. And communication, trust can't form without communication. So I just wanted to put that out there as a larger issue, because I think a lot of times people are looking at us and looking to us for specific answers about timing or what PPE or how we're going to manage aerosols. And I wish we could give you all that answer, but this is what Darla's role is on the CDA task force, and being able to provide that kind of information and know that she is there advocating for your hygienist interests, because she had the option to go on a panel about aerosols, finances, or PPE. And she had the foresight to think this is going to be a lot about PPE for hygienists. This is our main concern. So she chose that track, and this is going to be, her primary focus. So, Darla, I'm sure you can speak to this to some extent, but there's a limit to what you can share at certain points, but you're always, I don't want to put words in your mouth either. Like, I'm sure you're going to be able to share things with us when you can, but.
Can I add in there really quick? I just want to add in as well, because I know in the interest of time, one other thing that I don't think has been brought up is get in touch with your local dental society. Some dentists do not belong to other organizations, but they are looking to their dental society. And I had my local dental society reach out to me on Monday saying, hey, I've got dentists wanting to go back to work. Luckily, because I've invested a relationship with my dental society, I was able to provide them with a vast array of the evidence based on our state governor, our public health department, as well as Department of Healthcare Services. So if you feel that you don't have the relationship that you want with your dentist, form that relationship with your dental society.
Thank you, Rhoda, Allison, and Darla. We do have a lot of questions that are coming in for specifics on PPE, and again, I think we've touched on this already, that that's what this workforce task force is for right now. We cannot give specifics because we don't know yet exactly. It's all being reviewed right now. So we do want to share some of the resources with you in the next slides here. And again, these will be posted on our website. So just in closing, I would like to thank you for spending time with us this morning. Please know that the California Dental Hygienists Association is working for you. And although we are all volunteers, we do have strength in numbers, and our voice is heard. All of the resources that we mentioned here today can be found on our CDHA website at www.cdha.org. We can also be found on Facebook and on Instagram. And if you're not a member but would like to join, please do so through our website. Thank you to our panelists, Darla, Jennifer, Rhoda, and Allison. More than ever, we need to work together to be informed and stay engaged, and this is why your membership matters. Thank you again, and be well. We'll be in touch soon.